So rehab in general is a place where you learn the basics of getting sober, of staying sober. So it's a place you get sober, right? You detox. Some people don't have to detox. Some people do, depending on their use, what they're using or drinking. But um, you learn how to stay sober, and it's not about this is one of the hardest things to explain to people. It's not necessarily about staying sober. It's about not wanting to not stay sober. So not wanting to drink, not wanting to take drugs, right? The idea is not to sit there in conflict with yourself of should I drink, should I not drink, should I take this pill, should I not? The idea is of a good rehab, a good treatment center is to remove that conflict completely. And that is done on a day-to-day basis with tools that you learn, and that is done with dealing with underlying conditions. It could be trauma, depression, current life situations, whatever. Getting those sorted out, getting you a clean slate, and then giving you the tools to sort of navigate. That's the point to me of a good treatment center, because anyone can go to a treatment center and stay sober for 30, 60, 90 days. Right? It's about what happens when you go home, and it's about the transformation you have. There has to be a shift within where, and people come in different stages, right? So some people will come in more curious, and they're like, I want to stop drinking, but maybe I want to learn to have one drink, or maybe I want to learn to have one drug, or whatever, down the road, in a year. I just want to get my life back on track. Some people will come in done, just show me how to stay done. I can't stop, show me how to stop and stay stopped, right? So people come in at different levels, various stages. But wherever they are, we have to meet them where they're at, and we have to get them to a place where they have peace of mind, they have some hope, they have some bright outlook on the future, and they're okay in their own skin sitting there in a room, without, whatever, drugs, alcohol, and other things too. I mean, certainly there's some fillers, watching Netflix or eating, ice cream or smoking cigarettes. Some people do, whatever. But the idea is to get them to a place where they're not wanting to take a mind-altering substance and escape, and which is, that's the thing. And the other thing that with, like, if someone's sober curious, if they're like, well, I wonder what that's like. I mean, it's wonderful, I can say from experience, but also for that person, it's about, well, is it causing you problems in any way? A lot of people don't recognize the problems that they're causing. So that can be tricky, but for instance, someone will say, and I ask them on the phone, I said, well, I have these conversations all the time. Well, I'm not sure if I'm an alcoholic. I'm not sure if I'm an addict. I'm not sure if I need, all this. And I'm not sure either all the time. Miracles Asia isn't necessarily the best place for everyone, depending on where they're at, right? But treatment or therapy or some sort of thing in general usually applies. But it's, well, do you have a problem? Is it a problem? Is it causing you problems? And then they'll say, no, not really. It's my family won't talk to me though, or my work is having conversations with me. It's like, well, that sounds like a problem, and they say, yeah, it's a problem. Like, those are problems, but I don't know if that's the drug use, and so there's a lot of confusion when people are, with some people coming in.